Hello and welcome to Healthline 3. I'm Terry Simmons. Today we're talking about diabetes and heart disease with Dr. Jagan Beedupalli of Willis Knighton Cardiology. We'll be taking your calls throughout the show, and as a reminder, please make sure you're in a quiet room with your TV turned down all the way before making your call. The number is 318-219-4569. Be sure to call us to get answers to your questions all about diabetes and heart disease by speaking directly with Dr. Beedupalli. Thank you so much for being here.
Thanks, Terry. Thanks for having me. It's my pleasure to be here.
Oh, it's our pleasure. Thank you for taking time out of your schedule. We were talking about how busy you are. Busy being a cardiologist and taking care of this community is so appreciated. And being here today to talk about the tie between diabetes and heart disease is really fascinating. So let's just get right into it. What would you like us to know right from the start?
So diabetes is very common in the common population. So diabetes there are two kinds of diabetes, type 1 and type 2. Type 2 is where you have insulin resistance, where most of the people have what you call a metabolic syndrome as a precursor to diabetes. And most of them have like excess body weight and they're overweight, and that can cause insulin resistance, where the insulin that is produced in your body is not enough to drive the glucose into the tissue, so that you have high amounts of blood sugar in the bloodstream that is toxic to the blood vessel wall and cause lots of complications. The same thing even with type 1 diabetes, especially if it's not well controlled, that can cause all these kind of complications. So we'll be talking about all the complications that diabetes can cause and what you all need to be looking out for, and the lifestyle changes, or any other questions you all have. You're welcome to call us, and I'll be happy to answer all of them for you.
No, definitely. Our viewers love to call in, and they have such great questions that lead into something else that everyone is wondering about. So definitely call in if you have a question. Are there certain signs and symptoms that are particular to heart disease in a diabetic patient?
So diabetes, especially if it's poorly controlled, can affect your nervous system too. So they can have neuropathy, and just like they don't have much feeling, especially towards the in your feet or fingers. This is called peripheral neuropathy. The same neuropathy can affect different nerves in your body, and people with heart attack tend to have chest tightness, chest discomfort, chest pain, if you want to say. But in people with diabetes, sometimes these nerves are affected, so that you wouldn't have this typical chest pain. You could have very non-specific symptoms like severe shortness of breath that is sudden onset, and they can have some gastrointestinal side effects like severe nausea, vomiting, sweating, and stuff like that. So you need to be aware that this could be a sign of heart attack in people with diabetes.
So are these specific to people with diabetes?
They're not very specific, but these are some things that can mimic, or that can be a sign of heart attack in people. You don't necessarily have to have chest pain. Sometimes people ignore these symptoms as some gastrointestinal side effects, like stomach bug or something, and then shortness of breath for they inhale some kind of vapors while they're cleaning the floor or something, and then they just ignore it, and then the next thing they know is that they'll end up in heart failure, with congestive heart failure, because a big part of their heart muscle is dead from that heart attack, and there's nothing you could do, because once some part of the heart muscle is dead, things that are dead are dead. You can't bring them back to life. So in that situation, what happens is you'll end up having a weak heart function that can cause congestive heart failure, and the lifespan of that individual will be dramatically reduced, and then the quality of life goes down significantly. So to really know exactly what can mimic a heart attack, they need to be aware of all the symptoms, so that they can get to the hospital on time and get required care, so that your heart function will remain the same. Because if you go to the hospital on time and let us open up that blocked artery, which is causing the heart attack, then the chance of the heart muscle dying is very less, so that your heart function will remain normal, and they'll be able to enjoy a normal quality of life, and then the lifespan is not reduced, and they'll be like a normal lifespan like any other healthy individual, if they take care of their diabetes well.
So the faster they can get to it, the better.
Exactly. So the faster is better. Time is muscle. That's what we call it. So the more time you wait, the more muscle you lose. So if you lose more muscle, the more heart function is down, and then you have worse complications. The same thing even with the people, they can have strokes too, but have symptoms of stroke, you have to just rush to the hospital so that we can treat it, give clot busters if needed, or some of the treatments that we can do to reduce or minimize the complications of stroke. You know, people with diabetes can have same thing that causes heart attacks can cause strokes too, just like deposition of cholesterol and all the fatty tissue within the blood vessel wall can cause all these problems.
So these are symptoms, when you have diabetes, it causes these symptoms anyway. This is what's having clogging? Is that a symptom?
Yeah, people with poorly controlled diabetes,
Yeah.
as I was saying, you know, they can have high blood sugar levels, and these high blood sugars are toxic to a lining in your blood vessel wall. It's called endothelium. And then when you have high blood sugar levels that are toxic to the endothelium, that's damaged, and then once there is damage to this lining, then you'll have deposits of fat that get accumulated in these areas which are damaged, and then over time more and more cholesterol or fat gets deposited, and then it encroaches into the lumen. And once it encroaches into the lumen of the blood vessel, then if this blood vessel is supplying some vital organs like the heart, brain, your legs, then you start losing blood flow to these organs, and then their function will be compromised, and you know, they may end up having these heart attacks or strokes, or some people can have wounds in their legs if they have blockages in their legs, and then if the wounds don't heal, the infection gets to the bone, and then once it gets to the bone, it's extremely hard to treat it, especially if you don't have enough blood flow to that leg, and then you'll end up losing the leg. You know, they'll end up having amputations and stuff like that. So with good blood pressure control and timely help, when you have all these complications, will save a lot of pain and agony for these people.
Do you find people wait a little too long when they start having the symptoms?
Absolutely, we see that quite often. You know, it's not very uncommon. You know, we see a lot of times where people kind of ignore these symptoms as something else, and then they come in, and you know, and a lot of times, you know, they tend to smoke also sometimes, which is a very, very bad combination. Smoking is also toxic to this endothelium, and same thing with the diabetes. So that's a very fatal combination, if you will. And they kind of tend to ignore these symptoms, and then if you don't take care of these early signs, you know, some wounds that are not healing, especially if you have diabetes, and if you continue to smoke, the wounds won't heal, and then slowly it can get worse. And if you wait too long, then that's the time there's nothing much that can be done other than just to do amputation, or sometimes, you know, you'll end up losing a big chunk of your heart muscle with a heart attack, and then you'll have bad complications later on.
Yeah. Let's talk about smoking for a second.
Right,
Because we hear about the smoking, that's one that comes up all the time. We talk about any health, you know, any condition, and smoking. What is it about smoking that is so toxic to the tissues?
So smoking can affect your body in multiple ways. You know, one of them is the tar that you get from the cigarette smoke is carcinogenic. On top of that, the nicotine and the cigarette smoke also has some chemicals that are toxic to the endothelium, as I said. You know, so people say, like, you know, somebody comes in, you know, they get a stress test or something, everything is normal, everything is fine, and they continue to smoke. But you know, you wouldn't find anything wrong on a stress test, or they wouldn't even have symptoms of chest pain if there is a little bit of accumulation of fat in your blood vessel. Unless it gets to like 70% block, you wouldn't have any symptoms. So like 30-40% blockage in any blood vessel, say like blood vessel in your heart, it's like, say it's 10% or 20% blocked, and you continue to smoke, and this smoke is toxic to the endothelium, which is the lining of the blood vessel that I just talked about. And once it causes some damage to that lining, we call that rupture, we call that plaque rupture, where it ruptures. Once that ruptures, everything underneath that, all the fat and everything underneath that endothelium is procoagulant, meaning that it attracts all the clotting factors. Then your body thinks you're bleeding somewhere, because if there is damage to the blood vessel wall, that means you're bleeding, and your body tends to stop the bleeding by clotting. So you have damage to the endothelium within that blood vessel, and then it'll attract a clot. Once the clot forms, it kind of propagates, and then it completely blocks out the artery. When you have 100% blocked off artery, that's when you have a major heart attack. So people who have completely normal, no symptoms, you know, even if they're physically able to do a lot of stuff, they may think they're healthy, but you know, if you continue to smoke, these kind of stuff can happen that can lead to, you know, dramatic complications like ending up having a heart attack. And they might be wondering, I've been doing great so far, didn't have any problems. I used to run like 2-3 miles. Of course they won't be able to do it because their lungs are damaged too if you continue to smoke a long time. But these are some of the things that can happen if you continue to smoke. Number one, cancer risk of lung cancer, risk of kidney cancer, risk of bladder cancer. They're all high with smoking. And then you have what you call COPD, which is damage to the lungs, because smoke, of course, is toxic to the lungs. It can cause bronchitis, emphysema, and that in turn can cause some heart problems too, because if you have bad lung disease from smoking, that can increase the blood pressure in your lungs. We call that pulmonary hypertension, and it can put extra load on the heart, and that can cause heart failure too. And then on top of that, it can affect your blood vessels. That can cause heart attacks and strokes and loss of legs. We see that a lot. People who smoke, they more likely than not, if they're smoking for more than 20-30 years, they'll have some kind of blockage, some degree of blockage in their legs, and then they'll end up having complications.
Right.
So I strongly advise that quit smoking. If you're trying to quit, don't cut down, because cutting down never works, because you always find a reason to go back to what you've been smoking before. So way to do is cold turkey, put the cigarettes down and don't go back to it. Tell everybody that you're quitting smoking and put the cigarettes down and never go back to it.
And I've read before where as soon as you stop smoking, your body starts improving and get better. Is that true?
Well, yeah. Well, in the beginning, you might just feel like all the mood will be, you'll have a lot of ups and downs, and you'll have the urge to go back to smoking. There's also weight gain, constipation. These are all temporary side effects, but none of these complications would kill you. Like smoking would kill you, but if you stop it, then none of these withdrawals would kill you. So in the beginning, maybe for a month or two, you may have all these things, but after a couple of months, if you're strong, all of these will fade away, and you'll start noticing a big difference in your breathing. I would say probably in a, depending on how long you smoked before, probably in a year, you would see a huge difference in how you're breathing, and your exercise capacity increases, and the risk of cancer goes down to almost pre-smoking levels after, like, say, 10 years. Risk of heart disease goes down to pre-smoking levels, say, like maybe 2 to 3 years after you stop smoking.
So that's really good news to someone who says, well, I've been smoking all my life, the damage is done, I'm just going to keep smoking.
No, yeah. If it'll continue to damage, it can get exponential over time, but if you stop smoking, there's always hope that it'll come back. More likely than not, it'll be back to the pre-smoking levels, the risk, and the way you feel much better.
Right.
Right.
So let's go back to diabetes. Are there other organ systems that are excuse me, there's my cough for smoke. Not a smoker, I promise. But are there other systems that are affected by diabetes?
Yeah, as I said, of course, your vascular system, which supplies blood flow to different vital organs, will be affected with diabetes, especially if it's poorly controlled. And it can affect your kidneys, because it can cause what you call nephrotic syndrome or kidney failure, because it can damage the small blood vessels in your kidneys. It can cause kidney failure, and it's end up losing protein in your kidneys too, especially if it's not well controlled. And then it can cause heart failure, because diabetes itself is associated with, even if you don't find blockages in your heart arteries, sometimes we call that small vessel disease, where your diabetes affects really, really tiny blood vessels that you don't see on an angiogram. And these can cause weakening of the heart function, because it's not getting enough blood supply, and it can cause heart failure. So diabetes can cause heart failure, apart from heart attacks and strokes, and it can cause kidney failure, and also wounds to the legs, and neuropathy, because if you have neuropathy, you wouldn't feel the pain or pressure at some pressure points in your feet when you walk, so you'll put repeated pressure on the same place, and then you'll end up having a wound in that area, and then if you don't take care of the wound, then that won't heal, and that'll end up propagating and getting to the bone, and then amputations and stuff if there is a problem with the blood flow. But yeah, it can affect the nervous system, heart, kidneys and multiple different organs.
Yeah, it's
So
so
that's why you
interesting.
had to be really strict about blood pressure, blood sugar control, and even blood pressure should be strictly controlled in people with diabetes. In a normal person, blood pressure goal is less than 140 or 90 millimeter mercury, but in people with diabetes, high blood pressure is associated with all these end organ damage, which is like heart failure, kidney failure, stroke. So that's why you need to get your blood pressure to less than 130, the top number, and less than 90, the bottom number.
Right. It's so different when you're
Right.
a diabetic patient to really
Exactly.
pay attention to those numbers.
Exactly. So, and also, processed sugars are something that you have to be really careful about, because the instant spike, because your body doesn't need a lot of enzymes to break down these sugars, the processed sugars, just like sugar, you just put it in and then it absorbs into your body right away. So that's not good, because that high sugar spike in your bloodstream is what causes this endothelial dysfunction. So even if your blood sugar is overall well controlled, every now and then you consume these, if it's too often, especially if you consume these processed sugars, which can cause like a sugar rush in your body, it's not good.
And that could be as simple as a couple of donut holes or just a
Right,
little
every
bit,
now and
few
then
bites
you
of a candy
have to
bar.
enjoy your life too. So
Yeah, that's right.
maybe every now and then it's okay, but you should not make it like
Just make a habit of it.
Right.
Right.
Mm-hmm.
And so when we talk about circulation, particularly in the legs, how does having diabetes affect the circulation in the legs?
Yeah, so same process that I talked to you about. High blood sugars can interfere with the endothelium, which is the lining of the blood vessel wall, which is the innermost lining that keeps the blood flowing. It has a lot of chemicals that it secretes that will prevent clotting within the blood vessel wall, within the blood vessel. So over time, there is damage to this endothelium because of high sugar content. So once you have this damage to this endothelial lining, then you'll have deposits of cholesterol and atherosclerosis in these areas, and that can cause reduced blood flow in your legs. And then the same thing, neuropathy, especially poorly controlled diabetics can have neuropathy, which can affect their sensory system in the legs, and then they can start having wounds in their legs, and then the wounds can get worse, and then hard to heal because there's not enough blood flow going down there, because blood carries all the essential things to heal, and once you have reduced blood flow, then that can get worse. Infection gets worse, and you need the blood flow to fight an infection, and then once it dies, we call it gangrene of the legs, and then they you'll end up losing the leg.
Mm-hmm.
So if you come to the doctor on time with all these things, then we can check for any issues with the blood flow, and there's a problem with the blood flow before it turns out to be a gangrene. We could open the blood flow, that'll give it a better chance of healing of the wounds than if we wait until it turns black and gangrene, then it's all done at that point in time. But even at that time, even if they do the amputation, sometimes the amputation site won't heal, and then they may have to get it higher and higher if you don't have enough blood flow. So establishing a good blood flow to those wounded parts of the legs is vital to keep the extremities intact.
Yeah, I would think that you have a wound, it's treated, but if you don't have circulation there to help it heal, it's just not going to heal, right?
It's going to get worse,
Yeah.
and you'll end up having more problems.
Mm-hmm. Are there visuals, the coloration or discoloration? I know that you should obviously visually examine your feet if you have the
Exactly.
numbness, because if you can't feel a wound, at least you can see it
Mhm.
and do something about it. Are there other things to look for in the legs? Is there coloration or stripes?
Yeah, of
or-
course, start with, you have to really, as you were mentioning, you have to check your legs and make sure you're not forming any major calluses and stuff that
Right.
can eventually erode and cause wounds, and visually inspect for any kind of wounds. And other things that you need to look for that'll tell you there's compromised blood flow is loss of hair on your legs.
Oh.
And pain. Sometimes the blockages are bad, then you may have to keep your legs dangling down the bed for the pain to relieve, because you're getting help from gravity to get the blood flow down the leg. And if you're laying down on a bed with your feet up, then you'll have more pain in the leg. And so you have to put it down. Sometimes just discoloration of the leg, just pale color is something that can signify lack of blood supply. And then so if you press on the leg and release it, we call that capillary refill. where it takes time. Usually it should fill, if you press on the leg, it forms like a pale spot, and if you let off, then the color comes back. So that'll tell you how good the blood supply is. So if it takes longer, more than like 4 or 5 seconds, that means your blood supply is poor. So these are some of the things. Sometimes you can even lose nails because there's not enough blood supply there. So you'll start, the nail structure integrity will be lost, and then you'll end up losing the nails and cracked nails and stuff like that too.
Yeah. So what are some of the treatments for heart and vascular conditions due to diabetes?
So of course, lifestyle changes go a long way. I strongly believe prevention is better than cure. Once things are done, it's hard to get back to normal because you depend on all these other sustaining measures, if you will, to maintain a normal function of any vital organ. So prevention is very, very important. So people with diabetes, or in fact anybody with risk of heart disease, they need to have some dietary changes, like less carbs, especially with people with diabetes. Sugars, they need to cut down on sugars for sure. Low in carbs, medium fat, high protein is what I recommend to all my patients. And exercise, and at least moderate intensity exercise. It doesn't have to be intense exercise. Just 40 minutes each day. I call it rule of 4. 40 minutes each day, 4 days a week. So that's the minimum. That's recommended by the American Heart Association. So 40 minutes each day, at least 4 days a week of at least moderate intensity workout. It doesn't have to be very intense. It could just be walking around your block, or walking your dog, or just brisk walking that can get your heart rate up. Just spend like 40 minutes each day, 4 days a week. And that's minimum. If you can do more, that's even better. So because if you do exercise, also I would encourage doing some kind of weights also, people with diabetes, because if you build muscle, muscle is a good consumer of blood sugar. It's easy for the insulin to drive blood sugar into the muscle than any other tissue in the body. So if you lose muscle mass, then it's hard to control your blood sugar. So if you build a muscle, then it becomes a little easier. The insulin resistance goes down. So high protein diet and at least some weights, strength training, that's highly recommended in people with diabetes, because that can really build your muscle mass, and it decreases all the complications that are associated with high blood sugars. So exercise, as I said, diet, and when I say low carb diet, all the bread, pasta, potatoes, chips, fries, all the good stuff that tastes good, so you need to cut down on all that. I'm not saying it's hard to completely cut down on the carbs, but just cut down, because carbs are the immediate energy that you need. So those are the calories that you put in. So you cannot completely hold off on putting in any calories, because you need them to function. So you should not put any more than what you're spending, because if you put in any more than what you're spending, all of that will be converted to like triglycerides and fat, and you get deposits of the fat around your belly, and that can cause insulin resistance, risk of diabetes, or worsen complications. So cut down on the carbs, and cut down on desserts, sweets, all the sugars, and then medium fat, like dairy products are good, like milk, cheese, those are all good. They'll keep your hunger down, and they're also, they're not that bad. So moderate fat and high protein diet, because you need your muscle to maintain, to stay strong and do what you need to do. Because losing muscle mass is probably the worst thing that can happen in people with diabetes. So high protein diet, meat is a good source of protein, but definitely cut down on red meat like beef and pork, because those can be carcinogenic also, and also atherogenic, because that can cause all the problems that we talked about. So cut down on red meat like beef and pork, and white meat is good like chicken, fish, turkey. Egg whites are good, not the yellow, but egg whites. You can go to a grocery store and buy egg white cartons, and then make omelets or whatever you want to do with the egg whites. And then plant-based diet is always good, like greens, spinach, beans, okra. Those are all good source of vitamins and minerals. That are
and
good
there's
for
protein in vegetables too.
Yeah, there's protein in vegetables too. So these diet changes, exercise changes, definitely, and then no smoking, of course.
Okay, we have a caller for you, actually.
Okay.
Hi, Billy. Thank you for calling. What's your question?
The question is, well, I'm paralyzed,
Okay.
So I can't walk. But I roll myself pretty much 4 or 5 hours a day. Now, I've gotten off the opiates that the VA has given me, and I try to eat right and everything, but still yet I cannot seem to get my cholesterol level lowered, even at 40 milligrams of Lipitor every day.
Yeah, the cholesterol, 40 milligrams of Lipitor is still a medium dose. We could go up on it to like 80 milligrams. 80 milligrams of Lipitor could be taken, and there are more options that can be done to get your cholesterol under control. There's another medication called Zetia that can be added to get your cholesterol down, and even if it's not controlled at that point, there are other medications which are injectables, like we call that Repatha, Leqvio. These are more recent injectable cholesterol lowering medications which are very, very efficient, and also they are known to decrease the risk of heart attacks and strokes in individuals with high cholesterol. So those are some of the options. You may have to talk to your doctor about all these options to get the cholesterol under control, because definitely they could go up on your Lipitor dose or add medication like Zetia or use injectable forms. These are not everyday injectables, but it's something that you take it like once every 3 months in the case of Leqvio, or every 2 weeks in case of Repatha. So these are very, very efficient in getting your cholesterol down. So these are some of the options you may want to talk to your doctor about.
I just kind of wonder, my doctor is a veteran. He's a veteran doctor. Works at the VA.
Yeah.
And I just wonder why he hadn't, done, suggested anything different or something.
Yeah, I'm not sure what your cholesterol levels are. Maybe your doctor might be thinking that's well controlled, or I'm not really sure.
They tell me it's really sky high.
Okay.
And I quit. I ain't quit eating bread or rice, but I mean, I ate, the brown rice now, wild rice instead of the white rice,
Yeah.
and I try to eat, wheat bread, but
Right.
I mean,
the diet, definitely, the diet changes are good, whatever you're doing, but at the same time, your cholesterol could be a lot to do
it's not
with
coming down.
with your genetic makeup, and also your other, your situation of your liver, because the liver processes a lot of these nutrients that you put in, and it can make cholesterol and break down cholesterol, all that. So it may not be entirely dependent on what you're eating and your lifestyle, because there are some folks out there where they do everything right, but their cholesterol is still high, and we call that familial hypercholesterolemia. As I said, just high, just genetic makeup could be part of that. So don't get disappointed. There are medications out there available. Talk to your doctor and talk to him or her about your concerns, and then they should be able to help you out.
Yeah, and Billy you suggest just keep talking. And
Exactly,
Billy, just
right.
keep talking to your
Any
doctor.
concerns
and
you
keep
have,
asking.
just talk, because don't keep it to yourself.
Yeah. Thank you so much,
All
Billy.
right.
I hope you feel better soon.
All right, good luck, Billy.
And so, is there a way we have just about a minute and a half left. Is there
Okay.
a quick way, is it possible to reverse heart disease or slow the progression once it starts?
It's not very, very efficient in reversing, but so that's why I was saying always prevention is the best
Right.
thing to do before things get too bad. But even after you have all these other complications, maintaining a good lifestyle and taking the medications and getting your cholesterol under control and getting your blood sugar A1C under control is very, very important. But because I've seen in my practice that somebody who are really strict with all these, they stop smoking and take all the medications regularly, and I've seen blockages that have improved, not to a dramatic extent, but to a significant extent, that I feel that it could be from the lifestyle changes. So it can be done, but of course, if you do all these things, you definitely will reduce the risk of heart attacks for sure, or strokes, because you reduce the risk of these plaque ruptures and all that. Even if you have stable blockage with well-controlled symptoms, and if you're taking all these other precautions, the risk of bad things happening is extremely low.
Yes.
So,
And once again, too, so appreciate Billy calling, because once again, that's a great point. You suggest is keep talking to your doctor, keep bringing it up, keep communicating, because you want to know what we're hearing. All right. Thank you so much for being here. We
Thank
really
you, Terry.
appreciate it. And thank you for watching Healthline 3.
thank
We'll
you.
see you next time. Enjoy your afternoon.